The second case I will present is a 40-year-old asthmatic who has been in treatment for more than 20 years. Jim reported having to contain and suppress all feelings from early childhood, living with an impulsive, narcissistic father and a depressed, alcoholic mother. His father abandoned the family when he was 10 years old. His mother died from cancer when he was 24. Illness and loss by death remain markers in his mind, serving both as a threat and a lure, as his body seems to keep psychic chaos in check. Over the years, Jim has remained within close proximity to me. His residence is right near mine. Insisting that he did not want to appear intrusive or invasive, yet consistently resisting any acknowledgement of his wishes. I have felt invaded, as though he were struggling to be inside my womb. This was not a blissful state, but one fraught with conflict, discomfort, and danger. He would speak in terms of getting rid of thoughts and feelings and report that he experienced overwhelming anxiety, as well as feelings of dissociation and disconnection from his body, describing himself as lost in space. There have been many occasions when the experience of dissociation has occurred during sessions when a threatening subject emerged, usually something that would reflect an unacceptable aggressive or libidinal wish. He would describe shrinking and being far away. The content of sessions consists mainly of a litany of somatic issues and reports of dreams, all described without feeling. At times, the medical situation appears to be dire, and it seems that he could be in danger of dying. This is reported without much reaction, yet evokes strong feelings in me of fear, rage, provocation, hopelessness, helplessness, and of being shut out. On many occasions, I have felt shortness of breath during our sessions. This occurs in the context of a particularly rigid or contained presentation in the patient. In general, when in a stimulating or frustrating situation, he reports either a reactive rage, numbness, or nothing. In response to most situations, he reacts within a very limited range, inhibiting thoughts and not allowing feelings to flow, maintaining a rigid black and white experience. He reports dreams in almost every session. His dreams are particularly primitive and violent. Those qualities have been frequently noted in the dream research of psychosomatic patients. And in most of the dreams, he either witnesses or engages in violent acts that are quite graphic. One dream reflected an early conflict. He reported that someone is going through my luggage. I never felt safe. This dream reveals his conflict with the experience of invasion by the other, who forced him to take a passive role contrary to his impulse, and who posed a dangerous threat that kept him from allowing for a safe merger. As noted previously, Jim has conveyed an intense and at times overpowering urge to invade the analyst, which he consistently denies. The content analysis of sessions with Jim showed clearly how his thoughts and feelings are unformed or erased and seem to erupt in either dream content and in somatic symptoms, which at times can be life-threatening. All somatic symptoms were reported or displayed without association to thinking or feeling freely. The report of symptoms related to breathing correlates with the wish, fear of intimacy, which seems to be closely associated with rage, violence, and invasion. He suppresses murderous rage and an underlying wish to die that is linked to his wish for merger and its corollary, fear of intimacy. The meaning of Jim's asthmatic symptom became clearer to me. Breathing itself appears to embody the intense conflict of warding off the danger of invasion while yearning for merger and engulfment. The act of taking in and then releasing a breath enacts the struggle with the wish and terror of invasion and the aggressive opposing impulse for expulsion. As noted earlier, these are simultaneous experiences of rage and fear, along with a need to submit and an intense impulse to resist. It encapsulates the conflict and leaves him on the brink of death and is manifested in the transference countertransference matrix. In his sessions, Jim remains in a circumscribed range where things just are, without much exploration and not coinciding with real feelings, only a numb or anxious state. While his state remains precarious, some positive changes have occurred. He shows signs of some psychic integration and expresses some contentment with his current life. He's begun to allow the idea of having me inside as an internal presence that he can call upon, while in the past he would immediately feel panic and intense separation anxiety. He has fewer episodes of dissociated states and appears to be moving toward the side of life in more clear and direct ways. It seems that some changes are attributable to the psychic shifts and perhaps to my sitting with and tolerating the induced primitive states over many years of treatment. My doing this frequently provoked physical responses in me, such as shortness of breath, and allowed for his regression to states of merger and invasion. The various manifestations of regression occurring throughout the process, while quite dangerous and alarming, seem to have allowed for the shifts and expansion in his psychic functioning. That's the end of case number 2. It was at this point when I was practicing reading this at my home to my 2 dogs that I noticed that they were immobilized. And so I just want to ask if everyone here is okay. They're okay now.